Welcome to day 2. You guys are really good listeners, following directions, getting here on time. Thank you for doing that. I think all of you know me by now. I'm Sunitha Malepati. I'm the Vice President of the CACNA1A Foundation, and I'm kicking off day 2. And just wanted to give you a little bit of insight about what this day entails, why we put this sort of content together. Because when we were planning this year's conference, Lisa, Pankong, and our conference team, Amy, Teresa, Tim, we were honestly worried about recreating some of the content that we had in Texas and creating a just as magical of an event for you all here this year. So let's remind ourselves what we all looked like 2 years ago and what we felt at that conference last year. If you could play the movie. CACNA1A is a rare neurological disorder, but our kids are fighting battles every day. They suffer from epilepsy, autism, and a host of other neurological conditions. They deserve treatments and cures, and we are going to keep fighting, keep asking questions, and keep fundraising to push science forward.
CACNA is definitely very serious. It's something that doesn't just affect the patient, it affects the entire family. We're losing sleep wondering if our child is going to survive throughout the night, or what that seizure or what that hemiplegic migraine is going to cause for the future. And we could take 10 steps forward and we take 50 back.
There are many kids who look at Avery and think it's not that bad. And it's truly heartbreaking because there are many other kids who are in the hospital right now and people don't realize the severity of it.
CACNA1A is a debilitating disease that deserves a ton of attention, a ton of funding, and a cure.
The main reason we came to the conference was because we wanted to connect with other families. One of the hardest things when we first were diagnosed was that we only knew of a few other individuals essentially in the world that had been diagnosed, and none of them were in the United States at the time, and so we just felt isolated. And the foundation is giving this amazing opportunity at this conference to meet other families.
We don't interface directly a lot of times with patients. This is one of the very few occasions when we get to see that firsthand. Of course, we take care of them, but we are kind of going more into their personal lives and understanding what happens, hearing like half an hour long lecture about the child affected with a devastating disorder. It's heartwarming. I have no doubt that these type of gatherings will clearly improve the awareness, ultimately lead to better care and also better research.
There's so many people who are devoting their careers, to finding a cure, and I think that's really great. Another value of coming is the kids getting to be together. They're meeting each other, they are at the camp together, and they're like seeing kids and other siblings that are kind of in the same boat that they are, and I think that's awesome.
We're working really hard as a foundation to fund research, and as a result of it, everybody at this conference they're all benefiting. And so I'm really proud of that work, and we're grateful for the funding, and I'm really proud of everything we've done. And I guess this is the culmination of the last 2 years.
Funding CACNA1A, you're not just funding one rare disease, you're funding a community of researchers who are collaborating together, and the work that they're doing will impact CACNA1A, and it will impact all these other genes that are in the calcium channel or ion channels, and we are committed to really getting to that cure in our children's lifetimes and changing the course of what it means to be diagnosed with CACNA1A.
Beneath all of that, we've done so much, and just knowing that there are some of the best and brightest scientists around the world who are now collaborating and looking at CACNA1A and looking at for treatments and cures and looking to help us get clinical trial ready is one of the most encouraging things I could ever imagine. So more than anything, I'm walking away with hope and optimism.
But when you meet families and you see some of the children, it gives you a renewed sense of purpose. It just raises the level of urgency that we have to go back in the lab and try and come up with a solution for a devastating problem.
Each of us brings our own expertise, and we're really only going to be able to change things for this disease if we come together and we keep our children and adults affected by CACNA1A at the center of our work. And so I think collaboration is the key to a cure.
I was in denial for a long time, and it got to the point that I was comparing instead of being compassionate. And instead I was seeing other 3-year-olds, and I'm like, well, their situation is not as severe as mine. You know, their 3-year-old is walking around, their 3-year-old is running, their 3-year-old is feeding, and where mine is not doing any of that. I don't hear my 3-year-old's voice. So meeting them really helped. Yeah. It helped me realize that we're all going through it.
I think one of the most, excuse me, the most incredible thing about that video to me is just seeing the kids this year and how much they've grown. It's really beautiful. I think it's one of the reasons why we had Adam and his team come down here to do another video for us. You'll see him and his crew throughout the day, and a lot of you guys have volunteered to sit down and do an interview with him. And hopefully we'll be able to share this video at the next conference. So thank you for doing that. It's just really important for all of us in this room to continue to help raise awareness. And the videos like this, coming to this conference, wearing your t-shirts, honestly, everywhere, all of those things help. We built out the content for today's session directly from the feedback you gave us at that conference in Texas 2 years ago. That's why it's so important that you, again, complete another dang survey. The QR codes for the conference feedback forms are on each of your tables. So before you leave today or tomorrow, so we don't have to bug you via an email, but honestly, we probably will anyways, please complete those surveys for us. What we heard from the surveys is that you wanted to hear more about how to advocate for your loved one in a healthcare setting. You wanted to learn more about speech and language strategies, what neuropsych evaluations can tell us, vision-related issues, how to navigate the special education landscape, and then how do we ultimately think about transitioning beyond the school setting. So the speakers we've invited here today reflect those priorities you've articulated to us, and we hope that you find it responsive to your needs. In addition, we're going to round out today's sessions with breakout groups. We didn't have these in Texas, so it's a little bit of an experiment, but many of you told us that you wanted to be able to formally connect with each other, not just during the breaks and meal times. So we're giving you dedicated time to meet in smaller groups, debrief the conference, make lasting connections, and we hope that's what those groups allow you to do. I believe, though, today we're starting with the most important topic for the foundation. The way we operationalize our mission is threefold. We advance research, we support families, and we raise awareness. Yesterday, you heard a lot about how we are connecting with researchers and clinicians to advance our mission and advance our understanding of this disease. And believe me when I say that we have given our CACNA1A research network a tall task of ensuring that treatments become a reality for this community in our kids' lifetimes. Each of them are going home, they're going back to their labs, they're looking at the gaps and hurdles we face and the ones we have to overcome to determine what they can do in their labs to contribute to this collaborative effort. And today, it's our turn as a family community to figure out what we can do to support their efforts through research grants, donating samples, providing our data through the endless surveys we ask you to complete, but also what we can do collectively to support one another along this journey and raise awareness among the doctors who aren't involved in this network so we can find more individuals who have this diagnosis. It is impossible for us to get to 500 people in that natural history study if we only know of 300 families. That's all we know right now. We need to find families wherever they live. As you know, and I think by virtue of the fact that we're based in the United States, the vast majority of our resources are in English, That's who we've primarily gathered. But I'm really, really encouraged to see families here at this conference who are attending virtually that are coming from all over the world. Chris and Christina, thank you for coming from Australia. We have a crew from Italy, Germany, Canada, Turkey. I hope I didn't miss any other countries in the room, but you get it. People are starting to find the organization, and we want the organization to be truly global. We are impacted by this disease no matter where we live, and we want the efforts of this organization to benefit everyone. So I'm asking you all, through the session that happens this morning, to ask yourself, what can I individually do? What can our family do? What can my connections, my community, what can we do to advance these 3 pillars? And we're going to get into what others are doing, and it's a small fraction of the folks who are truly helping behind the scenes. But I think each of us can find one thing to take home from this conference and enact, so that when we gather again in 2 years, we can share the amount of progress that we've collectively achieved because each of us has stepped up. So I urge you to sit through this morning's panel. It wasn't a priority articulated by you all, but it is the most important priority of the foundation, is to engage you in this work.